Hi everyone, this is my first lecture of endocrinology in medicine. So today I will talk about the thyroid disorder. In thyroid disorder today I will talk about how the patient present in the ward, in the clinic, or how patient present to the doctor if someone have hyperthyroidism in actually. So before starting today I will talk in a clinical sides and not so much theoretical side. Today I will talk about the more and more clinical sides in which you will get an idea about how the patient present to you with which type of clinical features. So before starting, first of all I would like to talk about the first of all thyroid gland. Actually thyroid gland is present at the neck area, as you can see in the picture. It is present at the neck area below the cartilage, thyroid cartilage. So this one is a trachea and thyroid cartilage, and below this one is your thyroid gland. This is a isthmus, right lobe, left lobe, and isthmus. It's a connection between two lobes. So this is actually the anatomy of the thyroid gland. So thyroid gland is very important because it maintains the metabolism of every cell. It controls the heart rate, it controls the respiratory system, and it controls the GIT peristalsis movement. It also controls the body temperature, and it's a many functions. So this is a very important function which I told you now. So if thyroid is not function properly, if thyroid can be function hypofunction or can be hyperfunction, depending symptoms depending on which type of disorder. If thyroid is function if hyperfunctioning of thyroid gland, so it present the features like hyperthyroidism. If thyroid is hypofunction, so it can show clinical features of hypothyroidism. So this is about the thing about the thyroid gland. The thyroid gland is very important organ which can play an important role. So it can also maintain every cell metabolism. So I would like to talk about the important points related to thyroid gland. So in thyroid gland we know that there is a metabolism production. So before starting I would like to add one more point. Actually the hypothalamus which send message to the pituitary gland, and pituitary gland produce thyroid stimulating hormone. Thyroid TSH is the one which stimulates the thyroid gland. Then as a result T3 and T4 produce. So T4 have longer half-life as compared to T3, but T3 is more biological active. So in the peripheral tissue T4 is converted into T3 with the help of enzyme we call dehydrogenase. So this is about some important points related to thyroid gland. So this is about the main thing which I would like to talk about, the hyperthyroidism, which is also we call thyrotoxicosis. So today I would like to talk about the clinical side, how patient present. For example, if patient come to you, so patient appear thin and restless. Hands are sweaty with palmar erythema. Palmar erythema is the redness of hands due to hyperdynamic circulation in the body. So patient clinical features like that. On examination you find tremor. You can ask the patient to stretch out hands in front of you, and if you cannot find tremors, so then you can place the piece of paper on the patient hand. When you place the piece of paper on the patient hand, then you will notice is there any hand movement or not. If there is hand movement, it means fine or resting tremors. If there is no movement, it means there is no tremor. Then the upper sclera normally it is not seen while patient look down. So when you ask the patient to look down, when patient look down, so there will be lid retraction. I will talk about later, but now you just keep in mind that upper sclera normally not seen while patient looks down, but in the hyperthyroidism when patient looks down, so you can appreciate the sclera very well. So in my next video I will continue this lecture. Thank you.